Daily Dose here. I want to do a real quick update, and there will be a little bit of a theme to this video about the main topic as well that's coming up. So, first and foremost, I have been, for anyone who doesn't know, I'm running for 365 days this year, every day at least 3 miles. I'm on like day 120 something to look back. And I got sick these past couple days, which wasn't good. And yeah, it was just hard to run 3 miles when you're not feeling well, but I still got through it. No temperature or anything though, which is good. Just grogginess. Grogginess is a big thing. But I'm continuing to do that. Once it gets hotter, I'm going to be doing some outdoor runs as well. I just have to figure out how I'm going to track it. I might use like an iWatch or something like that. But we're just going to go from there. Now, let's get into the other topic that I was going to talk about real quick. And also, please like and subscribe to the channel. Okay, first topic, or the topic I was going to talk about. I am sorry I have not done a video in around a month. I know I kept saying I was going to do them, but, you know, I don't know what it is, but sometimes I was in the middle of making videos, and I've got this OCD thing where if they don't reach a certain standard of mine, then I'm like, I'm not going to do it. Now, granted, I'm not good at really making videos or anything yet, but sometimes it was just, I don't know, the video, I'm very particular about, in general, what I say and how it comes across, considering that I'm not a doctor or anything. But just so everyone does know as well, I'll be starting nurse practitioner school as well. I'll be doing that in the starting in the late summer, early fall. I'll be starting psychiatric nurse practitioner school, and I feel like that will actually help the channel a little bit because I'll be able to do a little bit more than just education when it comes to medications and whatnot, since I'll technically be able to prescribe when I get through the program and whatnot, or under a doctor. I can talk a little bit more openly about medications and things like that, and give more advice per se. Because right now, I mean, you can't really give any advice. Even as an RN, I can educate, but through YouTube, I can't just start saying, this is what's going to heal something, this is what's going to heal that. I can't do that. But wanted to let you know that as well. I know I'm going everywhere with this topic, but I'm still kind of sick. But I wanted to get this out regardless the quality. Lastly, so I wanted to go over just some what to know, or just general rules of how you should act or how you should carry yourself if you're working in a psychiatric inpatient setting. And what I mean by that is for like even employees. And this goes from things just like, for example, knowing your surroundings, to understanding how to call a code, how to clear a room if there is a code, meaning how to make sure all the other patients are safe, moving them out of the way and doing what you have to do from there. And really, because I've seen this, not even just in general, I've been hearing more stories about people getting hurt and whatnot in the psych setting, or just things that potentially could have been avoided if they would have known the situation. They would have been able to avoid it if they would have known just some basic things. So first thing, as an employee, we need to know our surroundings. We need to know our exits. We need to know that when you shut a door behind you, make sure it shuts, because psych patients, trust me, they catch on to those things. And if you don't push the door shut a lot of times, patients catch on to that, they can still slip out. So exits, knowing your surroundings, also understanding, once again, patients are very smart. They will try to trick you, and especially if you're new in the psych setting. A lot of times from what I've seen, because a lot of the psychiatric patients are repeats. They've been in there multiple times. And what I find is if there's a new staff, they know that because they know the normal staff for the most part. And they will try to get them to, I don't know, just in any way kind of bend the rules for them, or they'll test you a little bit. I've seen situations in general, this was a long time ago at, well, this was actually a while back, But I've seen this where a patient will be like, hey, can you help me with something in my room? And the staff member's like, sure, of course, yeah, because you're one to be helpful and whatnot. But with that situation, if you go in there and there's no camera, and then the patient starts accusing you of something, it can be tough. That's why this big thing is always have, if you got to go to a patient's room, always make sure that there's another staff member that has eyes on the situation. I'm not even saying they need to be in there with them, but just make sure somebody's watching. So if you have to say, hey, give me a minute, let a staff member know what's going on, get it done then, but do not go in alone. You'd be surprised what patients will say. Seriously though, I've heard some crazy ass shit said. With that, the next thing when it comes to the psych setting, recognizing if a situation is escalating. So if a situation is escalating, you need to make sure that the other staff members know what's going on and make sure you're all on the same page. Because sometimes you'd be surprised. There's situations that I've even seen where I'm like, how are other people not seeing this? That this code's going to happen and they're acting like nothing's happening. You need to let the staff members know, hey, if you're in the middle of something and you sense a code needs to be called, you need to just yell at the staff member, hey, call a code now. And they need to do it. Because a lot of times if the staff isn't on the same page, that can happen as well with codes. And also a big thing is recognizing if you are not, I'm not saying you're calling the code, but if you're actively in the code with the patient, regardless of what it is, you're trying to de-escalate them, you're trying to do this, trying to do that, always, if a patient is going off, and a staff member is trying to de-escalate them, because when you call a code, all the staff comes in. Having another staff member that the patient doesn't know or hasn't been working on that unit when they come to the code can be beneficial, because let's say the patient's going off on somebody and let's say they have schizophrenia or just whatever the condition may be and they're wanting to leave, you can, if you're the one who came into the code, right, like, called the code, somebody called the code, you run into the code. Sometimes what you can do is you can say to the patient as they're mad, hey, can I get you something? What's going on? Or, if they're stating a need, like they were thirsty or, just really whatever it is, trying to assist them in any way you can, because that can really help de-escalate it. You should never jump right away to a shot. If you can de-escalate the situation at all costs and just listen to the patient, because 99% of what we do, we just need to listen to them, then we would avoid codes. And lastly, real quick, and I could do many videos on just what to know in a psych facility, but lastly, I'll wrap it up with this. If you ever have a patient that is threatening you, do not be afraid to press charges. I know that, like, if I'm saying they're continuing to, and they're not mentally ill and they're threatening you, yeah, you can press charges on that. Especially if they start threatening and if they're very verbally aggressive, emotional, if they're going extremely hard at you and they're making severe threats, you have every right to. And lastly, for staff members, if you have a patient that goes with it, that's mad at you, targeting you, always, when you park and when you leave the building through a different exit point each time. Park your car in different spots. Trust me, if there's somebody out there that's following you, they know your every move then. That's just the reality, and you got to think smart. You got to think smart in these situations. Always, for example, when I go into work, I go through different doors, different exits. At one place in particular, I really have to do this. But no, you have to just be smart. And also, if there is somebody who's actively been saying stuff, I at least make it for the next couple months. I park in a different spot. I go through different exits. I know my exits, and I'm staying alert. Because when that patient leaves, you don't know sometimes what can happen. especially if they have a problem with you. So just wanted to let you know that. Once again, sorry I haven't done videos in a while, guys. I was sick recently, but that doesn't count out excuses for the past month. But I'm going to continue to do videos. I'm doing the running, even though I'm kind of sick. I'm still doing it. I'm not going to quit doing that, but I wanted to let everyone know I'm doing okay. I know I haven't put out a video, but I'm going to continue to do videos. And I've been doing them still every day, but I mean long videos again. And then I'm going to psychiatric nurse practitioner school, and I think this will really help the channel. I love y'all. Please like and subscribe, please. I love y'all. Let's spread the love. This is your daily dose of mental health with Adam. Peace, love, you know the drill.